Assalamualaikum and a good day. Today I will be presenting the concept paper on the use of evidence-based practice among occupational therapists in Malaysia. My name is Binti and together with me are my team members Puan Siti, Salwa, Talib and Encik Muhammad Azwan Azri. So moving on to the next slide, we will look into the introduction of EBP. So what is EBP? Evidence-based practice, or EBP, is the application of research findings into practices and decisions. And in this instance, EBP in client care for occupational therapy services. EBP also entails assimilating the best available evidence with clinical knowledge and expertise. And we also take into account the specific needs and preferences of each client. It is more likely that optimal client care outcomes can be achieved with persistent use of evidence-based practice. Using EBP entails rejecting ineffective, unproven care delivery strategies in favor of those that are scientifically shown to be effective and tailored to the specific needs of each client. This means that occupational therapists must be able to evaluate the relevance of studies to their specific client population. Occupational therapy practitioners have utilized evidence-based practice globally for many decades. And approach emphasis, as mentioned before, is firstly on the scientific evidence, which means identification of relevant findings in the many areas of occupational therapy practice, which can include in pediatric, physical or medical conditions, as well as mental conditions, mental health condition, and etc. Other than that is client preference, which is one of the highlights of occupational therapy practice, which include provision of client-centered care, where therapist and client work together as an ally towards the journey of recovery. And lastly is in terms of experience, which can mean years of experience working as an OT and qualifications or certifications that an occupational therapist obtains along career or also education. So what are the importance of EBP or evidence-based practice in occupational therapy? Firstly, the rationale between clinical decisions made by therapists becomes more visible, hence strengthening accountability. Secondly, promotes a culture of inquiry and reflection among occupational therapists, as well as continuous learning, and may help to a more efficient use of limited resources such as time. Next is to maintain professional registration, in which some countries requires its OT to constantly update themselves of knowledge related to client care for registration purposes. The next is informed services and funding. This means that through EBP, occupational therapists make informed decisions about services based on the three keys mentioned before, key components mentioned previously, which can help to reduce cost of care as opposed to using methods that may not have empirical evidence to support its use. And lastly, in some instances, relevant agencies may require occupational therapists to provide clarification on the decision of client care, and this is where EBP can help OT to justify clinical reasons. So what are the problem statements for this concept paper? Although occupational therapists generally have positive attitudes towards EBP, impediments to adoption were found in a comprehensive evaluation of available data. This includes workload and time constraints and drive, which were cited as causes for concern. This also includes limitations stemming from organizational factors, individual research competence, and the applicability of research findings into practice. Other than that, it was found that working in isolation and reduced support as part as barrier of implementation of EBP. And other studies had highlighted the best learning way that would foster EBP implementation. And lastly is a lack of understanding on the relevance of EBP in practice. So the objectives of this concept paper and study is to identify the use of EBP for occupational therapists in Malaysia. Firstly, looking into partnership between academics and clinicians, whether it would foster EBP, to identify the best ways to learn about EBP for occupational therapists in Malaysia, and lastly, to identify the reasons on how EBP can be personally relevant to occupational therapists in Malaysia. So the methodology of the study includes clearance will first be obtained before the study is conducted. A survey questionnaire detailing the above objectives will be disseminated to the Association of Occupational Therapists using snowball technique, where online questionnaire will be shared to ease access to the study to occupational therapists all over Malaysia. And the data shall be analysed using appropriate statistical testing analysis that can yield results to support or to answer the questions of the study. And inclusion criteria include Malaysian occupational therapists based in either east or west of Malaysia. Descriptive and inferential statistical data may be utilised in the study, and the demographic data of the respondents shall be collected and used for the purposes of the study. And major milestones of the study would be the beginning and ending of the data collection, analysis of the data, as well as interpretation of the result that will allow insight towards author's question with regard to the view of EBP among occupational therapists in Malaysia. The study plan includes that it will be carried out by the authors, which are qualified occupational therapists and as academics in occupational therapy profession. Relevant grants shall be applied where appropriate, and the study time frame would be an estimated of 1 to 2 years. An impact of the study is that it will determine Malaysian occupational therapists' perception on the practicality of EBP utilization, and it is anticipated that the result will be useful in promoting EBP, which will benefit occupational therapists, their clients, and the organization in which they are practicing, and in general, the improving standard of service of the profession as a whole. And lastly, it supports the 12 Malaysian Plan 2021 to 2025 in terms of enhancing the healthcare service delivery, where I'm going to quote a bit on this. In improving the well-being of the rakyat, more focus will be given to enhance healthcare service delivery through revitalizing of the healthcare system and greater collaboration in the consolidation of resources. Emerging technologies will be leveraged to support the initiatives for better provision of healthcare services, and implementation of these measures will contribute to ensuring healthy lives and promoting the well-being of the rakyat. With that, I end my presentation here. Thank you very much for your time to listen to this concept paper presentation.